So again, my name is Marlon Cuellar. I'm a program manager at the California Endowment. Been there about 5 years now, previously worked in the state legislature. And I've always had a passion for healthcare policy and for helping communities. So that's what's always driven me, and that's what drives me and my work here at the Endowment. But for those of you that don't know, I'll just explain briefly what the California Endowment is. It's a private health foundation. We really have a mission to expand healthcare to all Californians and really improve the health status of everyone. And I underlined all Californians because for all of us, that means everybody, regardless of your background, how you look, what your immigration status is. And so that's really driven our work here at the Endowment. We believe in empowering people and empowering communities, especially young people. We know they're the future and important to develop our future leaders. We believe healthcare is a human right, and we believe that in health and justice for all. So you'll see a lot of communications and taglines relating to that special messaging that we embody. Our headquarters are based in Los Angeles. We have an office in Oakland and in Fresno and in San Diego, but our work is really driven by the 14 communities that you see up here. And you'll see we reach all the way from what's called Del Norte. I always say Del Norte, but Del Norte is how it's commonly said. All the way to Fresno and City Heights and San Diego. The Endowment created a 10-year Building Healthy Communities initiative where we specifically decided to invest in these 14 communities, a total of about $1 billion over 10 years. And we're really in the middle of that initiative right now. It's the 5-year of that 10-year initiative, and it's pretty incredible, the results that we've seen in communities, how they've helped to really drive changes using a wide variety of methods to really improve their communities. And what do we mean by, what are the types of changes and what are the types of changes that we've seen in communities? The way to kind of explain kind of the team that I work on, which is the prevention team that's on here. So the Endowment on the statewide level has 3 teams that really work on different areas, schools, neighborhoods, and health. And my expertise and background in the Affordable Care Act has really allowed me to do much work around healthcare services, or what's called the prevention team. So that's why you'll see, this week the Endowment, actually tomorrow we have what's called an Agua for All event where we're raising awareness about the importance of water in the community. So that falls under kind of our neighborhoods work there. You'll also see we love hashtags at the Endowment. Social media, I see each other. We love spreading awareness through what we call different sub-campaigns. One of my personal favorites is Soda Kills. You'll see that, the importance of raising awareness of sugar-sweetened beverages and how damaging they are and contribute to diabetes. But the top 2 that I want to underscore are Health for All and Health for All Kids, and I'll get to those in a moment. So the California Endowment and what we call the DACA and DAPA, you'll hear more about that, but with regards to deferred actions, the reason why the Endowment cares so much about the deferred action programs and their impacts that they'll have in allowing immigrants to be able to not only get legal recognition, but be able to be eligible for healthcare programs such as Medi-Cal. Currently, those that are in the Deferred Action Program, what we call Deferred Action for Childhood Arrivals, are eligible for Medi-Cal if their income is low enough. Pending DAPA, we'll hear more about that. Depending on with the Supreme Court, with DACA recipients will be eligible for Medi-Cal in California as well. California has a legal infrastructure that allows us to be able to cover those recipients under Medi-Cal. But in general, we know that folks that are able to enroll in deferred action will be able to get work permits and more than likely be able to qualify for programs such as employer-sponsored health insurance, which is really important. So that's kind of led our efforts here in California, being that we've been ahead of the curve in looking at how do we, provide healthcare coverage to our undocumented children, the endowment has helped to disseminate a lot of information with regards to the ongoing opportunities to get healthcare coverage. We know May 1st, a lot of undocumented children will be able to be eligible for Medi-Cal, and so we've been able to create a lot of information for folks to know and get ready for those opportunities. Some resources, we develop resources not only for the community at large, but also for those providers, those people that are doing the enrollment, the day-to-day, to be able to help people enroll into healthcare coverage. So that's a big part of where we see, where we're able to leverage our resources and our dollars is in helping to disseminate information broadly. Also being able to help, like we said, communities on the ground that have been able to work to sustain their local level healthcare, county healthcare programs. We've seen a lot of mobilization of our communities that have really taken an active and passionate effort to really protect their services at the local level. So it's been really exciting for us this past year, both at the local level and at the statewide level. The Pope was recently in Mexico, as you know, and so we've had messaging around looking at opportunities and figures to help create that awareness of the importance of the immigrant population to our state. And finally, the real important work that we like to do is, and that we feel is really embodies everything that the endowment does, is lifting up the power of young people themselves, lifting up, they've lived through the situations, they know they're the best storytellers, and they're the most effective advocates that we have and that we know. And so the power of the voices themselves of the folks that are both eligible for these type of programs and or are left out of these programs are the important voices that we care about. So we have a whole ways to get involved or learn more about our Health for All campaign. I just realized we're on something called Snapchat now and all these things. It's kind of scary for me, but so the endowment is in a wide variety of mediums. If you would like to get to know more information, or if you have any follow-up questions for me, you can either ask them now or feel free to follow up with me. We're always happy to provide information about what we do and how we do it. So thank you so much.